Okay, this is Jeff with DSHABUSE.com. Today's date is March 22nd, 2020. I have on the phone a patient named Louie Walters. Lou, can you identify yourself, state your name and your last name, and spell it for me?
Yes, my name is Louie Walters. My first name is spelled L-O-U-I-E. My last name is spelled W-A-L-T-E-R-S.
Your first name is L-O-U-I-E?
Yes.
That's unusual spelling. Lou, we are recording this right now. Do you consent to being recorded?
Yes, I do.
Okay. So just for identification purposes, is your 2684 Penal Code Section 2684 commitment from Department of Corrections?
Yes.
Okay. And is your CDCR identification number K as in kangaroo 37237?
Yes, it is.
And your Atascadero identification number is Department of State Hospital is 071276-0?
Yes, it is.
Okay. And you came from Mule Creek State Prison on November 6, 2020?
Yes.
Okay. And you're a three-strike case serving 25 to life?
Yes.
And you've served 24 years, and your first board appearance is expected to be in May 2020?
Yes, it is.
Can you tell me what your, do you know what your current diagnosis is?
Yes, it's schizoaffective disorder, depressive.
Okay, is that all?
Yes.
Can you tell me what psychiatric medications you are for the schizoaffective disorder?
Yes, I take, let me see, I take Risperdal, specifically for the disorder that I have, and for the depressive part, I take Buspar and Effexor, and I'm not sure if I take other meds, but that's what I take.
Okay, so you're familiar with your mental diagnosis and you're familiar with your medication protocol. Do you ever hear voices? I mean, do you ever hear voices or anything like that?
Sometimes.
But do you feel the medications have stabilized you?
I feel like they're stabilizing me, you know.
Okay, so let's talk about the Effexor and the Buspar. How many years have you been on that medication?
Years, 12, 13 years.
And you feel it's been helpful for you?
Man, I've been on some of these meds as long as I've been in prison.
Right. So I want to talk about the Effexor and the Buspar. Okay. And by the way, you were on Unit 33 and you're now housed on Unit 1.
Yes. Temporarily.
You're on temporarily. Why were you moved to Unit 1?
I was moved to Unit 1 because of cellulitis in my right leg, and they needed to administer antibiotics by shot, and they needed to do it on a controlled basis so they could release me back to 31.
Okay, you have some kind of like a blood poisoning, correct?
Yes.
Okay. Now, this Effexor and Buspar, you said you were on that 12, 13 years in prison?
Yes.
Okay. Now, when you came to Department of State Hospital's Atascadero on 2684, that was November 6th, correct?
Yes, November 6th, 2019.
Okay. Now, when you first came to the hospital, you were assigned to Dr. Gaines, the psychiatrist?
Yes.
Now, that medication was crushed for approximately 2 months.
Yes, it was.
Okay, and then they stopped crushing it, correct?
Yes.
Do you know why they stopped crushing it?
Because I'd asked staff to talk to Dr. Haynes, and I'd asked Jennifer to talk to her, to explain to her that that I hadn't exhibited any untrustworthy behavior, and I'd like to being crushed, and lo and behold, that's what she did.
So you went to staff and you told them that that you were a trustworthy individual, and Jennifer, you're referring to Jennifer Hatfield, the psych tech on Unit 33?
Yeah.
Okay. So you went to staff and told them that you were trustworthy and that they should vouch for you to Dr. Gaines and stop crushing the Effexor and Buspar, and they managed to do that, and they stopped crushing it.
Yes.
Okay. Now I've already told you that I'm not here to go to the police, and that my investigation of Atascadero has to do with, I want to preface what I told you so that people listening to this, that I asked you to be honest, because the next question I'm going to ask you, that I've been doing an investigation and I've talked to other people, because you started selling your medication, correct?
Yes.
Hold on, go ahead. You faded out.
Yes.
Okay. And I'm not out to bust you. I'm not going to report you to the police, and that's why you're being honest, correct?
Yes.
Okay. So they stopped crushing your meds up until about 2 weeks ago, correct?
Yes.
Okay. We're going to get to that in a second. But you started selling your medication because you don't have any money on your books, correct?
That's correct.
Okay. All you receive is the support you receive from the state, which is what, $12.50 a month or something?
$12.50 a month, yeah.
Okay. How much were you receiving? So you were getting the pills, and Jennifer Hatfield, she's a psych tech, correct?
Yes.
Okay. Now, when you would receive these pills from the med window, how would you conceal them? And before we talk about selling them and how much you received, what would you do to conceal them?
I just...
You'd cheek them, or what would you do?
That's what I do.
You would cheek them and walk away from the window?
Yes. Yes.
Okay. So, in terms of selling them, you would get how much for the Effexor?
$1.50.
And how much for the Buspar?
$2.50.
Now, were there other people besides you in the hospital that were getting it uncrushed?
I don't know.
I mean, were you...
I don't know the specifics personally.
How many customers did you have?
Just one.
Just one customer? Was he on your unit?
Yeah.
Okay, and again, I'm not going to the police. Can you tell me what his name was?
I don't know if I'm comfortable doing that.
Well, it's important for validation purposes. This, again, we're not going to the police, but in order to verify your story at some point, can you please tell me what his name was?
Yeah, it was, it was Danny Davis.
Danny Davis?
Yeah.
Danny Davis. Okay. Okay. I think we've covered that. Was anybody off your unit you were selling it to?
What?
Was there anybody off your unit that you were selling it to?
Yeah.
Who?
At one point.
More than one person?
Yeah, a guy that I didn't really know. It was just somebody introduced him to me.
Do you know what his name was? Okay. Do you know the name of the person that introduced you to him?
Yeah, it's Ronald's, I'm trying to think the guy's name. I can't grasp the name right off that.
Do you know what unit he lived on?
Yeah, he lived on my unit, 33.
So a guy named Ronald on your unit introduced you to a guy that you sold it to.
Yeah.
So if you can think of it later, I'd like to. And again, I want to assure you that this is not for the police to bust anybody. This is at some point to deal with Dr. Gaines and the inconsistencies. I want you to understand that if you need Effexor and Buspar, you should get it. But, you also shouldn't be selling it. And we don't want you to get in trouble, but it's all about you getting the treatment you need and being treated appropriately, okay?
I do need it.
I want you to understand, sir. This is about you getting the treatment that you need, but it's also about, we don't want people, we want people like Dr. Gaines to give people what they need, and, but also you shouldn't be selling your medication.
You're right, I shouldn't.
But so I want to address this. So 2 weeks ago, it was started crushing it again. And you're currently receiving your Effexor Buspar that's being crushed, correct?
Yes.
Tell me what Dr. Gaines told you. Why is it being crushed now? Why is your Effexor Buspar being crushed?
Dr. Gaines says that there's rumors that people are sniffing pills and that, that I could or might or might not be involved, and as a precaution, they were putting mine on crush.
Okay, so she told you that she's going to start crushing your Effexor and Buspar because there's rumors that patients are sniffing that medication on the unit.
Yeah.
And you offered to take a blood test to prove that the Effexor and Buspar was in your system.
I did, because the reason that I did the blood is because I started taking my meds again about a month previous.
Okay, so you started taking your Effexor Buspar, and you weren't selling it for about the past month?
Yeah.
So you actually didn't sell it for a couple months. You sold it for just a short period of time?
Yeah, just a short period of time.
Because previously I had suggested that you might have sold it for longer than that. But you actually, when they stopped crushing it, you only sold it for maybe a few weeks?
Yeah.
Okay, so you haven't been selling it for the entire time that it's been uncrushed?
No.
So you just sold it sporadically?
Yes.
Okay, but you have been taking it for like the past month?
Yeah.
Okay, so you sold that out of necessity, perhaps, because you didn't have money?
Yeah.
Okay. So you believe that you passed that that blood test, that it would be in your system?
Yeah.
But you don't know for sure what the results were?
No, but I'm positive that I passed.
Okay, but were you in any way responsible for the people? Were people sniffing your medication?
No.
Okay, let's move on then. I think we've covered this enough. You said you referred to Dr. Gaines as a monster. Or when I asked you when I told you that other patients referred to her as a monster, you said you agreed with that. Why?
Because she talks down to everybody in the unit, everybody. And
give me examples. Tell me some examples.
An example would be, I need to talk to you. Well, we're talking right now. And
for example, a patient will say, I need to talk to you, and she'll say, we're talking right now?
Yeah.
So a patient who might be in crisis, a patient who might have emotional distress will say, hey, doctor, I need to talk to you. And rather than her make an appointment or say, I'll see you later, she'll never
see you on a personal appointment.
She'll never make a personal appointment to see a patient?
Yeah, never.
Never?
Never.
Wow. Can you give me any more examples? You said, okay, wow. Well, when she told you, what she told you about that you might be responsible for people sniffing meds, where did she tell you that at? In the hallway?
No, in team.
Oh, she told you in team. Okay.
Yeah.
All right. Well, that's wow. So that's your experience. You may not be speaking for every patient. I'm sure she probably meets with some patients, but that's your perception that she doesn't meet with anybody, correct? Do other people complain about that?
No, I'm pretty sure she don't meet with anybody.
Have you heard other patients complain about that?
Yeah.
Okay. Talk about filing complaints, people's fear of filing complaints and being sent to prison. Please describe your understanding of that issue.
People in the prison commitment units are all afraid, especially on 33. They're afraid to file send you back to prison if you make waves.
And have you seen people get sent back to prison for making waves?
Yes.
Okay. What types of comments have you heard staff make?
Staff, well, the other day, a staff member called Ronald Cottle, called him a cancer because he kept standing up for himself.
A patient named Ronald Cottle?
Yeah.
The staff member called him a cancer because he kept standing up for himself?
Yeah.
What was that staff member's name?
I don't know what his last name is. It's Jonathan.
His name's Jonathan?
Yeah.
Is that the one that supervises the showers?
Yeah.
Okay, I think I know his last name. How old is Ronald Cottle?
40-something.
What types of complaints does Ronald complain about?
Everything.
Are his complaints legitimate?
Yes.
Okay, I will interview Mr. Cottle. You're in a wheelchair. I want you to talk to me about the handicap shower and the complaints that you've observed about the handicap shower.
Well, for 3 or 4, 5 months, it's been at least four months, I'd say. The handicap shower's been out of order, and what I mean is there's 2 shower heads in this shower, one that's up high and one that's down low. The one that's down low is so low that you'd have to bend over you'd have to be set down and bend over to get water on you. I mean, it's even lower than that. And it's been broken. The upper shower head, it won't work. And they haven't come to fix it. And there's guys that get in there and have to, and they're in bad shape. They're in wheelchairs, and they're having to go. I don't know how they're doing it, but they're accomplishing it. They're getting showers taken, and I know it's really a struggle for them because.
Well, you're in a wheelchair yourself. How are you dealing with it?
I got semi use of my legs.
So what are you doing? Are you going in the regular shower?
I'm going in the regular shower.
Okay, so is that kind of dangerous for you?
It is, because my legs I lose control of my legs after about 10 minutes.
Have you heard that patients are using cups of water to pour over their head and stuff like that?
Yeah, that's what they're doing.
Are you aware that there's
They can't bend over in the shower, so they're having to take cups of water and take a shower by pouring cups of water on top of their heads.
Okay, are you aware that there's a working shower in the seclusion area that they're not using?
I'm not sure about that.
Okay, last thing. In terms of assistance in mobilizing through the hospital, you're in the 30s. As a patient who uses a wheelchair, have you experienced difficulty getting around the hospital, and have you observed other patients and staff not assisting you?
Yes. The only help that I really was getting on Unit 33 to get any place when I needed to go to an appointment or whatever was through an inmate, somebody that volunteered to push me to the appointment and push me back. The staff really aren't, I don't know the right word, but staff aren't really good in that area.
So the staff were not accommodating you to get your appointments.
Yeah, exactly.
Is it true that the hallway at Atascadero is so long that you can barely see to the end of it?
Yeah, you can barely see to the end of it. The hallway is so long, and there's points in the hallways where you got to go up a hill in the hallway, and it's almost impossible in the wheelchair sometimes when you're pushing
and the only way they can get up is if another patient or inmate helps them.
Yeah.
And the staff don't help them.
No.
Okay. Let me end this recording and stay on the line, please.
Okay.
Yeah, I'm back on the recording with Mr. Louie Walters. Lou, you consent to being recorded?
Yes.
Okay, I didn't ask you your age on our previous recording.
I have to make a correction. My whole name is Louie Walters.
Yeah, Louie Walters. We got that on the first recording.
Okay.
What is your age?
62.
62?
Yes.
62. And what is your birth date?
1/2/58.
1 January 2nd?
Yeah, January 2nd, 1958.
Okay, we're going to go ahead and conclude this recording. Stand by.